So my name is Shawn Peterson. I work at Baptist Health Lexington and Richmond, and I'm one of the hematologists and oncologists there. So I chose to go into oncology and hematology because it's a very special field. It's one of those fields where we get to spend a lot of time with our patients. We see them very frequently, usually every 2-3 weeks, sometimes a little bit longer. But we really get to go on a significant journey with them from the start of their diagnosis to the end, whether it's a complete remission, completely the cancer's gone, or whether it's not. You really get to go on this journey with the patients and experience not only with them but their families too. And so it brings a lot of joy. It's important to provide world-class and comprehensive care to this community because it's a great location in the state that builds the eastern part, the southern part of the state to where people can't always make it to Lexington. And a lot of people feel with Richmond or some other smaller communities that you're getting maybe less cancer care as a big city like Lexington or Louisville. But we are the same doctors that work in Lexington and in Richmond, so you're getting the exact same care, and the nurses are pretty much the same in both locations as well. So you get the same level of care whether you go all the way to Lexington or whether you come to Richmond here. We do have access to clinical trials through Baptist Health Richmond. We have almost, I think, 20 clinical trials open, ranging from breast to lung to neuro cancers, brain cancers, as well as GI cancers as well. So when a patient is starting their journey and they're eligible for a clinical trial, it means that there's a lot of options open to them. The clinical trials are where we make our breakthroughs in medicine. And I always tell my patients too that when you're looking at a clinical trial, because they hear a lot, especially nowadays with clinical trials, that we don't just give placebo medications. We don't give water pills or sugar pills to people. You get the highest level of care, the gold standard level of care, in addition to an experimental medication, which most of the time and some of the time can help really improve your cancer care and their cancer care and prognosis at the end of the day. So when you come into our clinic, you're going to be experiencing a lot of different people and a lot of different faces, but they're all very good people at the end of the day. Usually you're going to check in with one of our MAs, Josh, then you will be seen by another MA, Phyllis, who will take your vital signs, get your history, medications, and then usually you'll see myself or my nurse Amy or one of the other nurses around that day. And then you'll go through your standard physical and examination with me. And then depending on whether you need treatment or labs or not, we will have you checked out and seen then. And the great thing is our infusion center there, if patients do need treatment, are just down the hall. So it's all in one building, all in one location. You don't have to get lost in a big hospital facility. They are going to experience, like I said, very high level of care. You're going to get just the same level of care that you would get at any big city hospital like Lexington or Louisville. You go to the University of Kentucky or University of Louisville or any of the Baptist facilities in those locations, you're going to get the same level of care here in Richmond as you would in those facilities. As a Baptist provider, we are excited and proud to offer high level and comprehensive cancer care to this community. It's a great community that we, again, are proud to serve.